I'm Robert here with my friend Liberty Adair for our HPT 450 Section 10 healthcare video introduction. Liberty, go ahead and introduce yourself for me, please.
My name's Liberty Adair.
And go ahead and give me your job title.
I am the Hillcrest Imaging Supervisor over an outpatient imaging center.
And go ahead and give me an overview of the department here.
We have X-ray, bone density, CAT scan, MRI, ultrasound, and we do primarily outpatients, and they're all usually scheduled. We do have add-ons, and that's pretty much our volume.
Okay. Let's see here. Daily, what kind of numbers do you look at daily?
I can tell you on a monthly level better.
Okay, that's fine. Month is fine.
So for X-ray, we do about 700 X-rays a month, and for ultrasound, we do probably between 350 and 400, and our MRIs are somewhere between 175 to 200 a month, and our CAT scans are around 180 to 200 a month.
Okay.
And I personally help out a lot in X-ray, so I know on a busy day we can do like 77, up to like 77 patients a day there.
Wow, that's good volume. So what are your roles and duties here?
Well, I'm kind of like a coordinator or supervisor. Obviously, they're scheduled patients, so we have a lot of scheduling issues that have to be dealt with system-wide. Patients are supposed to be in PO, or they're told to show up over here at our medical office building versus the hospital, and we have different little incidents and things that happen along the way, and so I try to keep that running smoothly, and so scheduling's a big part of it, and I help register and I help do X-rays, and I'm also in charge of evaluations of a lot of the techs. There's really a lot of little things that go on, like my duties. Really, it's probably a longer list than what I'm mentioning, but we also have to look at the reports that the radiologists read, make sure that those are accurate, or if questions come up about those. There's pretty much make sure things just on day-to-day operations go smoothly around here with no problems, and if there are problems, we address those problems and talk to those managers or directors and try to get everything all panned out. So.
One of the reasons I chose you for this interview is how far you've come in your education. When I met you when I was in my radiology program, give me a little background on your education.
Well, I started out as a LVN, a licensed vocational nurse. I got that in '99, and I actually was taking my nursing state board when I decided to apply to X-ray school, and I completed X-ray school in November of 2001, and then from there I basically just decided to kind of climb the ladder in my field. I got my bachelor's in 2006 from Midwestern State University in Wichita Falls. And then I worked on my Master of Science in Radiological Sciences at Midwestern, and I graduated in 2010. And then I was actually going to work on my doctorate, and I couldn't really find one that was real specific to my field. And in doing that, I decided to try to obtain a second master's. So I'm working on my master's in healthcare administration. I kind of have decided that I've been a nurse, I've been an X-ray tech, I'm in management. I would like to be more in the healthcare administration part. When people ask me, well, what does that mean, or what do you want to do, I really am not sure exactly how to tell you. Just they have so many different ones that specialize in different things. You have like there's like a safety officer. There's CEOs over different parts of the big picture, I guess, at the hospital. I don't know, I would like to be more part of like policies and deciding things, because right now I'm really more of a working supervisor, and although I feel like I have like the knowledge and the skills, it's hard for me to be able to um, actually utilize it all the time, because I'm having to deal with immediate issues or x-raying a patient, or immediate things here.
Understand. So what are some of the hardships that you've come across through your education since you've gotten this far?
Hardships through my education. Well, school's not easy, as you probably know. It's kind of hard working full time and having a family, and just trying to meet all the deadlines and fit it all in with normal life. Hardships, well, I mean, just in general, it's difficult. I mean, you have to pretty much just kind of keep going and keep pushing, and knowing that, I kind of always tell myself, oh, just one more week, one more month, we're almost done with the semester, and then by the time you make that goal, you're like, oh, we're starting off, only have, 4 months left, and you just kind of baby step it along, as to knowing that you're working for an end goal and that you're almost there.
So how long have you been in the field now?
I've been in healthcare since '99, so let me see, I guess it's been around 14, 15 years.
And what made you decide to get into healthcare?
As a young person, starting college, and I think about my daughter in school now, not knowing what she wants to do. I really didn't have a set, like, oh, I always wanted to be this or that. I kind of like helping people, and so I just applied to X-ray into nursing, and kind of just went with whichever one took me, first. And then after I was a nurse, I just thought the X-ray sounded really interesting, and I really didn't even know what all it entailed, So I decided to do that route.
Cool. So as far as your role here, what is the best part? What do you enjoy about what you do here the most?
I enjoy, hopefully, just making a difference on people. We X-ray a lot of patients who have been in like traumatic, accidents. They were just in the ER for a motorcycle car wreck, or thrown from a horse, or whatever their story is, and they come and see us, and they're X-rayed, a lot of them at least once a month, if not even more frequent than that. And it's really nice to see them progress and get better, and you kind of end up having kind of a relationship with the patient. Y'all kind of can joke around and kid around, and it's just nice to see that they come in not being able to walk with external fixators on their feet, and then finally one day they're just walking through here, and they're back to normal. So it's kind of rewarding, to see that. And so I would think just that would be a really good part of our job.
And on the flip side, what are some of the difficulties you face day to day, day in, day out?
For me, being a supervisor, the difficulties, everybody wants to complain to you about everything, which sometimes, legitimate complaints, not a big deal. People not getting along, having to listen to different people, wanting you to do something about somebody else's, business or whatever. It just sometimes is not the funnest part of being a supervisor, in having to, sit down and have, talks, performance talks with people, because, we work with everybody here every day, and you're pretty friendly with everyone, and I try to be, to the point, but not really a mean supervisor, but I do try to follow the rules, and so the hardest part is pretty much just probably any kind of performance issue or or problem that's going on, and having to deal with that. Everything else seems pretty easy for me.
Okay. A couple final questions. So as far as your education went and is still going, what kind of advice can you give to me and the rest of my class on, I guess, just getting through it and just just trying to get through it all?
I tell people seriously to never give up. Like, that's one thing that I didn't let stop me, and I'm going to teach my daughter. But as probably everyone knows, it's very competitive to get in any of the programs now. You have to have practically 4.0s, and I personally I had to retake anatomy and physiology 3 times when I was younger. It was really hard for me, and I've had to repeat classes, and just keep trying and keep going, and just don't let anything get you down. That's the main thing I can say, because I do watch my sister's trying to get in a nursing program, and I know she just gets really easily frustrated. And I mean, once she gets one bad grade, she's ready to throw in the towel. And all you can do is keep trying, and ask what else extra work can be done, and just know that if you do have to retake something, that you're already a step ahead of everybody else. So that's it. Just keep trying.
Okay. And then as far as where you are in your career now, what kind of advice could you give to me and the rest of my class on advancing through the health field and yeah?
I think there's chance for advancement in any of the healthcare fields. Actually, my original plan was to be a LVN, bridge over, get my RN, work on my nurse practitioner. I was kind of had planned my life a different route, and I don't know, I got an X-ray and I liked it, and I just knew that I wanted to advance the most that I could in my career. And so I just started out doing the bachelor and the master's, and I do eventually want to get my doctorate. And I like setting little goals for myself. When I was in the master's of radiologic science program, a lot of them would write in like the Radiology Management magazine. So that was a goal I set for myself, and I had an article published in December of 2010. And so just like finding new little things to kind of keep you going, and like new challenges to deal with, I think is very helpful.
Okay. All right. Well, that's all the questions I have for you. I really thank you for partaking in this.
Thank you.